This study will be looking at the effect of verbal persuasion during 1RM testing. The 1 repetition maximum, or 1RM test, is a common and inexpensive method which is used to determine the required load for an individual's training objectives. The 1RM assesses the maximum amount of resistance through a full range of motion for a certain exercise, and often tests a particular muscle group. It is used for athletes who are wishing to increase their muscular strength and endurance. The 1RM test is also used to assess the effects of placebos. Placebo use in scientific testing has been well documented in various studies, and has mainly focused on the use of ergonic aids which are used to increase performance. A placebo effect is a result of an individual's positive psychological or physiological response to a consumed substance. It is based on their expectations that the substance will inhibit a positive result, and not from any active ingredient. Participants' expectations are acquired through previous experience or knowledge, and this is what underlines the placebo effect. Expectations can also be attained through interventions during the experiment, such as verbal persuasion. A study which looked at the effects of verbal persuasion showed there was no change in behavior in a group who were persuaded to think the amount of exercise they were doing was sufficient. This was compared to a control group who were given no information at all. Another common form of placebo is sugar tablets, which are used to replace a performance-enhancing substance. One study proved sugar tablets to be effective through the use of 1RM testing, when the results of one group declined when they stopped taking the placebo. It was concluded that the placebo sugar tablet had an influence on the observed change throughout the study, and this was due to the expectation of participants that what they were taking would aid their performance. Based on previous research, this study investigated the effects of a placebo sugar tablet on upper and lower skeletal muscle strength through the use of verbal persuasion. This was to determine if the verbal removal of the placebo had any effect on the performance of participants. The null hypothesis states that there will be no significant difference in performance after the verbal removal of the placebo. The alternative hypothesis states that there will be a significant difference in performance after the verbal removal of the placebo. For this study, 15 college-aged men, who were apparently healthy, volunteered themselves to participate. All of the subjects were informed as to the experimental procedures and signed informed consent statements and medical history forms prior to completing the testing. The entrance criteria included a signed statement to say they had currently been performing upper and lower body strength training for at least 3 days per week for the last 6 months. They also had to state that they had not consumed an ergonic aid for the last 4 months, and had to agree to refrain from any resistance exercise for the duration of the investigation. Table 1 provides the mean and standard deviation of the involved participants' demographic information, including age, height, weight, and body fat. After the screening, the eligible participants were briefed on the study design. They then completed a familiarization session, where they were instructed on proper lifting technique, which was verbally described as well as demonstrated. After a warm-up, all participants performed a 1RM squat and bench press. After adequate rest, they then completed as many repetitions at 80% of their 1RM for the squat and bench press to test their endurance. At the end of the familiarization session, participants were given a 3-day food diary to complete. 4 days later, participants completed their baseline testing. At this session, all participants' demographic information was recorded. The participants then completed testing for the 1RM bench press, 1RM squat, 80% bench press, and 80% squat. Upon completion, participants were given a 3-day food diary to complete prior to the next session. The participants were also given a 4-day supply of a sugar tablet and were informed that the tablet they were consuming was composed of a powerful amino acid compound which has been proven to increase skeletal muscle strength and endurance by 10 to 15%. They were instructed to consume the tablet 3 times a day and given an adherence log to complete. 4 days later, the participants completed the first session of testing. Their weight was recorded before they completed the strength and endurance testing. After the session was completed, participants were given a further supply of the supplement. However, they were then told that it does not work. This indicates the verbal removal of the placebo. They were also once again given an adherence sheet and a 3-day food diary. On visit number 4, participants completed their second testing session. Weight was recorded, as well as their strength and endurance results. Upon completion, participants were informed the supplement they had consumed was a sugar tablet. The results were compiled, and a one-way repeated measures ANOVA was performed to see if there was a statistical significance between the testing sessions. A post-hoc analysis with a Bonferroni correction was used to determine between which trials the results were significant. Figure 2 shows the mean and standard deviation for each trial of the squat and the bench press. The results for the 1RM squat show there was a significant difference between the baseline trial and trial 1. Furthermore, there was a significant difference between the baseline trial and trial 2. The results for the 1RM bench press were similar, with a significant difference being found between the baseline trial and trial 1, as well as the baseline trial and trial 2. Figure 3 shows the mean and standard deviation of each trial for the number of repetitions each participant achieved at 80% of their 1RM for both the squat and the bench press. A significant difference was found between the baseline trial and trial 1 for 80% of the 1RM squat repetitions. However, the results for the 80% bench press found no significant difference between trials in the number of repetitions which were performed. The results showed that a significant difference was found between the baseline trial and trial 1, as well as the baseline trial and trial 2 for the 1RM squat and bench press. The insignificant change between trial 1 and trial 2 after the verbal removal of the placebo suggests that verbal persuasion had no effect on the participants' performance. One study which was completed found similar results in that verbal persuasion was not effective, and in this study was unable to elicit a placebo-induced pain reduction. The change in performance between the baseline trial and trial 1 supports research that expectancy has an influence on performance. Research has shown that positive expectations will likely lead to a positive outcome in the results. One study found that the reveal of placebo during 1RM testing resulted in a decrease in performance. Another study which was conducted used a placebo caffeine substance or a perceived placebo substance during 1RM testing. The results showed the caffeine placebo group performed better, supporting the theory that positive expectations will influence results. Conflicting research found by Furlong in a double-blind 1RM study found no difference between a placebo group and a herbal supplement group, where neither group's expectations would be higher than the other. Although there are many studies whose results support the effects of positive expectancy, more research could be done in the area on how to more directly assess expectancy and modify it to suit a particular setting. In conclusion, the results accepted the null hypothesis in that no significant difference occurred between trial 1 and 2 after the removal of the placebo. Trial 2 did not show a decrease in strength after the removal of the placebo as was expected, which concluded that verbal persuasion had no effect on the results. A significant difference was found between the strength performance of athletes between the baseline testing in trial 1 and the baseline testing in trial 2 in the 1RM squat and 1RM bench press. It has been concluded that this is a result of expectancy by the athlete that the placebo will have an effect on their performance. Thank you for listening.